So a child should be seen by a neurologist, really a pediatric neurologist if at all possible, anytime they've had a seizure that is not what we call a febrile seizure. That's a specific situation in children who are aged 6 months to 6 years old who have a seizure in association with a fever. Apart from that, I would advise that all children with unprovoked seizures be seen by a child neurologist. A child can grow out of seizures. It can happen really at any age. In general, if a kid has been seizure-free for 2 years or sometimes more, we'll consider tapering them off of their anti-seizure medications at that point to allow them the chance to see if they've grown out of their seizures at that point. There's also many other treatments besides medications for epilepsy. In people who don't respond to medications, there are special diets, there are certain devices that can be used, and in some cases, in the right situations, in someone who is intractable to medications, surgery can be a potential option, and in some cases can cure an individual of their epilepsy. There are certain risk factors that can predispose a child to seizures. One is having had some type of injury to the brain as it's developing, or things like a stroke. Sometimes things like tumors can also cause seizures. And having a history of prior febrile seizures can also make one more likely to have a seizure later on. We also know that kids who have developmental delay or other sorts of neurological problems or some genetic syndromes are more likely to have seizures. Children with seizures can do most anything that other children can do. They can play and they can participate in sports, they can play with their peers, they can play on the playground. There are a few things that we restrict. Anyone with seizures should not be in water by themselves. Usually that means they should not take baths without supervision. Showering is fine. They should not be in a pool or not be in the ocean or any other water without appropriate supervision. Also, if children are of driving age, they are restricted from driving for 6 months in the state of Virginia following a seizure that would impair their ability to drive. There's a few other specific situations in which you may want to avoid if you have a history of seizures, but your doctor can talk with you some more about that.